Roll it up, tuck it in. This is where the 420 begins. Welcome to Animo's 420 Sesh, where we talk about cannabis, the most commonly used federally illegal drug.
Yo, it's Animo. It's so good to see you this evening. So glad to have you here. And of course, my beauty, my angel, my one and only, my Valentine. She's mine. Not yours. She's mine.
Yeah.
How you doing, Boo Boo
Hey,
Cakes?
Boo Boo Cakes. I'm doing good.
Yeah. Did you have a good day at work today?
Yeah, I did.
Yeah. Well, that's so awesome.
Yeah.
I got a question for you.
Okay.
Will you look at me? There you go. Hi.
Hey.
Will you be my Valentine?
I have been, and I certainly will.
Will you be my Valentine every day of every day of your
until
life?
Yay! Forever.
Yay!
You're my forever Valentine. I am excited about Valentine's Day.
Yeah, because what are you doing?
Well, we're taking a trip.
Oh, we are.
We're taking a trip.
Where are we going?
Somewhere.
Oh, yeah?
Mm-hmm. It's secret.
Oh, it's a secret, but it's a Valentine's secret. Yay!
Yes. Well, anyway, we're going to go on a trip. And it's going to be awesome. It's going to be great. I mean, I got to tell you, you know what? I don't know why, but I've been wanting to go play pinball machines.
Ooh. You know what, my love? I think we're going to do that this weekend.
I think so too.
Yes.
Yeah.
That'll be great.
So, but before we get to the weekend,
yes,
we have to get through these other days. But what, my dear Animo, do you have in store for us today? And I'm not talking Reese's Pieces.
Well, I appreciate you asking me that, Miss Sweet Love Muffin. Tonight's actually a very interesting episode because we are actually going to be looking at the contraindications of marijuana first. As much as I want to focus on the benefits, the health and well-being of marijuana, it would be disrespectful to not look at the contraindications. So this evening, we are talking to a lovely person. Her name is Rachel, and she works at an inpatient treatment center, which I think, how do you come about saying, I think I'm going to go work at an inpatient treatment center? That's got to be a hard gig. Yeah. So I'm very interested in seeing what it's like for her, people who are dealing with, if they're, a serious drug addict of marijuana. So I'll be interested in knowing what the contraindications are that she has seen as an LPC. She's a licensed professional counselor. So I'm really looking forward to having her as a guest tonight. Yeah. And my Boo Boo Cakes is going to be right there with us and talking with her and stuff like that. So stay tuned because we have an excellent show for you. And I can't wait to learn more about, what we're about to talk about. This will be fun. I'm actually very excited to hear her side and see that side of the world because, we have another interview set up with the LPN to find out. So the opposite. She's looking at the contraindications tonight, right? Episode 3 is all about the benefits. Oh. So stay tuned. Okay. Don't forget, roll it up, tuck it at the end. Oh wait, that's not my song. That's no. I don't remember. Roll it up, tuck it in. This is where the 420 begins. I made it up. I don't know why. Anyway, did you know cannabis is the most commonly used federally illegal drug? So stay tuned and let's get stoned. And hey guys, we're back, and tonight we've got Miss Wonderful Rachel on our show. But before we do that, I did kind of want to talk to you before we go into this. So tonight's episode is all about examining marijuana's contraindications, exploring the benefits and contraindications of marijuana. So welcome to another episode of Animo's 420 Sesh, where we delve into the multifaceted world of marijuana. I, of course, am your host, Animo. We've got Miss Boo Boo Cakes, also known as Tyra. But I'm very thrilled to have with us tonight with us Miss Rachel. Miss Rachel is with us today for an enlightening discussion about marijuana. We're going to explore the topic that has been at the forefront of many health and wellness topic debates. The benefits and contraindications of marijuana. As society's views on marijuana use continues to evolve, it's crucial to understand both its potential benefits and the precautions that our people should take. Our special guest, Miss Rachel, is a licensed professional counselor who works in an inpatient drug treatment center. She brings a wealth of knowledge and experience to our conversation, particularly in the context of addiction and recovery. While we do highlight the promising benefits of marijuana, especially in terms of its medical use, we also want to respect and delve into the expert insights our guest has on the potential contraindications and risks associated with its use. Although marijuana has been found to offer numerous benefits, I can say so for myself, dealing with anxiety, depression, but it also can be provided for pain relief, reducing inflammation, and a series of other benefits. However, these attributes have made it a topic of interest for many seeking alternative treatments. However, this discussion would be incomplete without acknowledging the complexities and potential challenges it presents, especially for those in recovery from substance abuse. While we aim to provide a balanced perspective that honors the experience of individuals who have found relief through marijuana, but also want to respect the critical work that's being done in treatment centers. So we want to say thank you so much, Ms. Rachel, for being here tonight. And people, if you're curious about the potential benefits of marijuana or just understanding more of its risks more comprehensively, then this episode promises to be very informative and thought-provoking. So why don't we get started? And I am looking forward to getting to know Miss Rachel a little bit better. And so my first question for Miss Rachel is, can you briefly describe your background and experience as a licensed professional counselor?
Well, thanks for having me. Super
Absolutely.
excited. I just want to also say, like, I totally agree that there are benefits, and we'll talk about that more too. But yeah, like my profession working with addiction has definitely sculpted my paradigm shift in how I think about marijuana. Right, so it hasn't always been this way. I haven't always thought of it this way. So I just want to say that. So my experience has really always been in substance abuse. To be honest, I kind of like fell into it. I always wanted to be like, those people in the FBI, right? That talk to the serial killers. But they just don't have internships for that. So I ended up in an outpatient substance use facility. And then my first job out of grad school was actually in a methadone clinic. I don't know if y'all are too familiar with methadone.
Yeah, I used to live in Alaska, and right in front of my apartment was a methadone clinic. And it was interesting to see the people lined up it was primarily in the morning time, when you saw them lined up at the door.
Yep.
So
yeah, that's typical. Yep. So that was my first job out of grad school. So like 22, 23, didn't know much about anything. My first job as a counselor there. So that was a very high, acuity population, homelessness, and a lot. And that was in Baltimore City, which is one of the biggest opiate prone cities in the country. So that was something. And then I went and worked in a juvenile detention center. So I worked there for a couple years. So there's substance use involved in that, right? But
was that?
Yeah, go ahead.
I'm so sorry. Was that more of like a when you said in juvenile detention center? Are they the ones that are getting in trouble, like truancy and stuff like that?
Oh, they are being charged with some serious. There's murder and
okay,
gang affiliations, things like that.
Okay. Wow.
And then I moved to Georgia. So that was up in Maryland. And then I moved to Georgia and I did private practice. So, you know, that's the typical, I see my therapist once a week, twice a month type of deal. So all the stuff, anxiety, depression, PTSD, self-harm, a little substance abuse sprinkled in there. Um, and then now I work at the inpatient substance use facility in Georgia. That's in Fulton County, and I've been there for almost 2.5 years.
Wow.
Mm-hmm.
So it sounds like you have, a wide range of experience
Mm-hmm.
from people who could seriously benefit from marijuana in some of those instances. And then, of course, what brings you here today, basically. How did you get in? So you've been an outpatient, you've been in juvenile detention, you've been in the psychotherapy, I guess is what you would call it,
Yeah, you can call that outpatient too. Mm-hmm.
outpatient. And
Mm-hmm.
here you are in an inpatient treatment facility. You said you were in Fulton County?
Mm-hmm.
Oh, wow. Okay. So what brought you to become an inpatient, to work at an inpatient treatment center?
Yeah, and to be honest, I think about that a lot actually. I'm like, how did I get here, right? Because it is a very high acuity population, right? Like some people are coming straight out of jail, withdrawing from alcohol and drugs, coming off the street. Some are high level professionals, right? Like so all across the board. Um, but I was doing that private practice, and I didn't really feel fulfilled in a way.
Mm,
I'm really well with like the leadership, the teamwork, the community. And I've always really been drawn to like there's a certain personality of the substance use population. There's just a certain personality. I feel like I click with them, I vibe with them, I get it, I
that
understand
makes
it. Yeah, and I just feel more myself in those types of environments. So that's why I was like, I gotta do something different. I gotta get in there and
Wow. Yeah, for sure. Well, I thank you so much for what you do. I really do appreciate it. So I would like to understand probably a little bit more about some contraindications specifically related to marijuana. Could you explain what contraindications you may have observed in patients who use marijuana?
hmm So I will talk about like not even just the inpatient facility drug treatment, like just even like in terms of like that outpatient, right? So we're not normal people, right? But we're people without substance abuse, like are trying marijuana, right? So in outpatient, I had this guy, and he was I think 23, severe social anxiety, right? So he found that marijuana was the way to cope with that anxiety in order to go out there and experience the world, right? And hang out with his friends and meet new
Yeah.
people, go on dates, right? And I get that, right? I totally get that. And in terms of for him, like it was kind of like, well, what's my other option, right? My other option is Xanax, right? And we can see how addictive Xanax is, right? Or anything along those lines, right? And I'm all for psychotropic medication. I'm all for that. It's just there are some that are addictive and very risky, right? So the guy's like, I can go the route of Xanax or I can go the route of marijuana. But what I saw was happening with him over time was it was almost like a band-aid. It wasn't really helping him develop skills, and it wasn't really helping him socialize anymore. He actually became more isolated,
Mm,
right? So in the moment, it may have given him that drive to go out and that lower the inhibitions to not think about what other people thought about him and be afraid and nervous. However, long term, it was doing quite the opposite, right? He was becoming more paranoid over time, like
mm,
when he wasn't using it, if that makes sense.
gotcha.
So
Gotcha.
so I've seen it be helpful for people with, like you said earlier, people with anxiety, people with depression, definitely people with PTSD, struggling with nightmares. things like that. I come from Maryland where it was medically legal, and by the time I left, it's recreational, right? So not many people have a problem with it
Right.
there. But the more I got involved in the addiction piece, that's where I feel like I really started to see how risky it could be specifically for that population. So the way I look at it, and we both like science, right? So the way I look at it is when you use alcohol and you use methamphetamine, any type of drugs, right? What's happening in your brain is the reward center, that pleasure center. We've all heard of dopamine, right? That is getting exponentially increased every time you use it, right? And then we want more and we want more. That's how addiction forms, right?
Right.
So, I hear all the time at work, it's so funny. They're like, oh, well, my problem's alcohol. It's not marijuana. And I'm like, you're right. And play this out, right? You go out there, you're done using alcohol for 45 days. You go out there and you smoke marijuana. You may not have that same addiction to it that you did alcohol or those other drugs, but the pleasure center in the brain is getting reignited every single time. And for people with addictive personalities or addictive traits or addiction, their brain doesn't know the difference, right? So with people without
Makes
addiction,
sense.
right?
Yeah.
And people without addiction, I can see how you can manage it, right? You can use it recreationally. You can do those type of things. People with addiction, we talk about it like an allergy. They don't have that ability because their brain becomes rewired in a way that is unmanageable. It becomes unmanageable.
Right.
So that's a big piece of it, I think, for people with addiction. The reward center, it's so easy to return back to those other addictive behaviors. So that's one contraindication that I would definitely highlight. And I've seen people when they're using marijuana, it's helping cope with stress, depression, anxiety, PTSD symptoms. And then over time, it can actually increase. And we've seen this. I think we've seen this in people, right? Like the paranoia that comes with being high on marijuana, right? It helps people with appetite, right? But sometimes it becomes binging, right? It becomes that other disordered eating. So there are a lot of ways that it can become too much, and not a lot of people I've noticed have the ability to turn it off. Some do, right? So I think that's where I get really concerned with my patients and some people. It's like, are you able to
Right.
manage, right? Manage or moderate, right? Moderate.
Yeah, everything in moderation, right? Gluttony.
Mm-hmm.
Wow. I guess so. If you think about it, if you do use it as a coping mechanism and don't find the skills necessarily to get out of whatever situation you find yourself facing, I could see that being a
Mm-hmm.
total addictive behavior because you're falling into a trap. I think. So I just wonder. I guess that's a question for another story on another time at another
Well, I think
podcast.
that's exactly where I would go next with that, right? Like, just to be brief about it, like if you're using that as a coping skill, it becomes an avoidance mechanism,
Mm-hmm.
right? Opposed to okay, this is what I can do that's healthy for me, that will help regulate my emotions or help me tolerate stress or distress or however you want to put it. But I think you're absolutely right, and that has to do with the brain and neural pathways and all that stuff.
Well, and I think it's necessary. And I feel like we're getting off topic for a second, but I just want to say this. I think it would become necessary, not become, it is necessary that people become educated on the different terpenes specifically that are in
Mm-hmm.
each one of the different flowers that are produced so that you can identify which one is going to work with you and work with those cells that are being targeted by that particular terpene so that you can use it in a beneficial way so you're not being torn down, or you're not dealing with the the issue. Like you had mentioned, it's just a band-aid on some people's problem. Instead, let's rip the band-aid off. I mean, this goes for many situations in this world,
Absolutely.
but rip the band-aid off and get to dig in, and let's find the core of the problem and get to it. So I think education, in my mind, regarding marijuana, specifically in the field that you work in, education is key to being able to, as my next question would be, have you observed in any of your, and maybe not in Georgia, but in Maryland, did you observe at any point in time where marijuana was used in a capacity to treat in a treatment program of some sort?
No, honestly, even in Maryland where it was medical, right? Like they're going to a doctor outside of, right?
Mm-hmm.
It ethically and legally, it's just not there. It's not
Yeah.
there, right? I can even talk to you about like there's other ways. Ketamine assisted therapy is a thing,
Mm-hmm.
right? So that we would never bring in to a treatment facility, right? So
Right. Gotcha.
I think there's a lot a lot of layers to that. And no, I really haven't.
Well, I think about like here in the state of Georgia, so it's illegal, right? Recreationally. We do have it sort of medical, sort of. There's only 2 dispensaries in the entire state here, although 5 licenses have been given. But you have to have one of 18 conditions in order to get it. And almost 75% of them are near to end of life. But that again, that I feel like I'm going off somewhere else.
No, but I mean, I think that just goes to show like it hasn't made the way into to treatment, right? In
Right.
terms of like legitimately clinically based mental health or addiction treatment. Yeah.
Right. Yeah, totally. Because mental health, depression, anxiety, PTSD. Well, PTSD is on there.
Mm-hmm.
Um, but I don't like, for instance, me. I have been diagnosed with PTSD. But does my PTSD indicate that I am eligible for the medical card, or because it says you have to see some sort of trauma? Well, I mean, everybody's perception of their own trauma is
Right.
theirs. So how can you determine what is, bad enough for one person might not be bad enough for somebody else.
Mm-hmm. Mm-hmm.
So, but yeah. um,
I'll say on that though, from a clinical standpoint, that
mhm,
has changed over time, right? Clinically, like we absolutely understand that trauma looks different from each person, right? For someone, it could be abuse, and the other person, it could be war, and the other person, it could be poverty, right? It could be knowing that my sister was abused, right? So
mhm.
clinically, we're there with that, right? But then the treat, like if we're using medical marijuana, it's not, they don't connect. Not everything is all together. you
R-
know?
right. Like a disconnect kind of thing.
Yeah. Mm-hmm.
Yeah. Well, you've answered a lot of questions that, I mean, you've given us so much information. I do have a couple questions regarding any challenges or insights that you may have. What are some of the biggest challenges that you can think of that you face when dealing with patients who have used marijuana?
Yeah. So I think a big one is the lack of willingness to admit it's a problem, right?
I guess that probably goes for every 420 baby.
Yeah.
I ain't got a problem. I don't know.
Nope.
Tyra might say something different, Boo Boo Cakes. What do you think?
Yeah.
Mm-hmm.
I don't know what the
Just
answer to. Yeah.
just for the record, I do not partake. But my thing is when it's just hard for people to see
an addiction,
Mm-hmm.
you know. I mean, no matter how you word it. For example, myself, I don't do, marijuana or anything like that. But boy, let me tell you, I will do, chips and dip in a heartbeat.
Mm-hmm.
You know what I'm saying? I mean, I will sit and eat those, and that could be,
Mm-hmm.
an addiction. There are all types of things you could be addicted to, but you know what? You have to admit to it and just own that. Talking about ownership of something, I think you should just own that, and it is what it is, no matter what words you put with it.
Hmm.
People have addictive personalities and mindsets, and it's just one of those things. And if it's something that you enjoy, and whether it helps you or not, or if it's just something that you do, like they say, for recreation,
Mm-hmm.
just admit it. Uh, you know, I'm addicted to it. It's just kind of like watching, football. I love football, so But that's what I'm trying to get at is, it's just a word, but
Yeah.
it has a definition, and that is a definition.
Mm-hmm.
True.
You
That's
know.
very, very insightful. You
Hmm.
know, um, no, I would not say that I'm addicted to marijuana, but if I think about it, yeah, I probably am. I love it. Um, have I gone periods of time without it? I have. I've done without it.
Mm-hmm.
Has it been, sometimes it's been by choice because I've wanted to do it. Other times it's been maybe because I had a drug test or something like that where I've had to detox and clear my system. Um, but overall, yeah, I mean, I guess ultimately I am addicted to it. I want it. When I'm around it, I want it. I like what it does for me. I do not think in any way, shape, form, or fashion for myself, and I'm only speaking for myself, is that I have coping skills. I have learned coping skills. I have been in treatment centers. I have been in inpatient care. I have. I have been counselored weekly. I've done those things, but I have taken the time to learn and desired them. That's what it is. I have wanted to learn how to cope so I didn't feel that way. And when I say that way is indicative of depression, anxiety, social anxiety, panic attacks. I didn't like feeling the depression is just suicidal ideations. Oh my gosh, it's just absolutely some of the scariest things I have ever experienced. That to me is horrific being suicidal. But I desired not to feel those things. And so because I've desired not to feel those things, I found the coping skills necessary to get beyond that. I'm not saying I'm healed. I will always have these diagnoses, but it is a day to day, and Tyra can attest to it. But when marijuana, if I'm stressed, if I am anxious, if I am panicky, oh my gosh, it's the best thing for me.
Mm-hmm. Mm-hmm.
It is, but if I didn't have it, I have coping skills to do without it.
Mm-hmm.
Breathing activities, counting activities, things like that.
Yeah.
But I do see, and I know I'm going off on a tangent. But that is
Oh, it's
very
okay. Go
interesting.
on, girl. Go on, honey.
Please. Please.
But I do agree the addiction part is hard. Okay, so I'm a smoker, right? Not I smoke cigarettes. If I had to choose between, well, it's don't ask me to choose between the two because I like them both very
I know.
much. But if I had to, if it came down to it, where like my neck's going to be cut off and I had to choose between cigarettes or marijuana, I would choose marijuana. I would give up smoking cigarettes in a heartbeat because I can get over that. I can get over marijuana. I have, but there is something about a cigarette that I don't get when I get with marijuana. And
Mm-hmm.
I don't like that. I feel like cigarettes rule my life. Marijuana doesn't. And I think there's a difference between those two. And that's just for me.
For sure. I think you can even differentiate between addiction and dependence, right? And like what I've seen in my patients is like, so okay, some of them can't put the marijuana, right? They'll do marijuana, cocaine, and alcohol, right? Like, they can't put any of it down. There's some of people like that. There's some people that they have a huge problem with other things, but they smoked marijuana for a little bit and they can put it down. They haven't smoked in 10 years, right? There's people fall into all different categories. But what I think I've seen most of the time is like addiction is that like if I don't have it, I'm withdrawing, right? There's that piece, that element of it, right? For me, it could be caffeine, right? If I don't drink a cup of coffee in the morning, I'm getting a headache, I'm getting moody and all that stuff. Where what I've seen with marijuana, it's more of that like emotional dependence, right?
Mm,
And I don't know, like I'm not trying to say that's a bad thing, right? It's like that when I'm stressed, I need that. When I'm having a panic attack, I need that, right? Yes, we can have other coping skills. I think that's where the people I work with differentiate is because that is their only coping skill. Their
right.
life, and this is what I always say to them, right? They're like, "Oh, I don't need help," you know, that like that denial, right? I say, if your life has become so unmanageable that you needed to come somewhere else other than your home, you have a problem, right?
Yeah.
And I think that's the piece that I want to make clear too is like addiction involves your life becoming unmanageable, not being able to
Gotcha.
hold jobs, not being able to hold relationships, not being able to legal problems, accidents, right? Like all that stuff comes with it. It can't be a one size fits all type of deal for anybody, you know. And I think hearing the benefits that you get, I could see how that's helpful, you know.
Hmm.
Well, I think you hit the nail on the head, though, when you just said about how it affects not just that one person, it affects everybody
Mm,
connected to that person in some way, form, or fashion. Um, if you have an addiction problem, no matter what it is, um, and you end up having to go um, to see somebody about it or whatever, you know, that you have family, you have friends, you have coworkers, you have people that are concerned about you or worried about it, trying to keep their eye on you and
mm-hmm.
trying to make sure that you're well, you know, because they don't want to see you go down that road, you know, but when you have to go do something like that to get help, that's good. But that also needs to be, um, again, you need to own the fact that, yes, do have a problem and I need your help. You know,
Yeah.
it's not bad to reach out for help.
Mm-mm.
But everything that happens to you, the things that you do affects other people and people need to, you know, notice that.
Yeah.
Well, in that regard, speaking from experience, my own personal experience, like you're talking about how it does affect everybody. It does. But the person that it is directly affecting, for instance, me,
Mm-hmm.
if it was me, I'm sorry. I have blinders on. You are not important to me at this moment. It has nothing to do with how much you're loved or wanted or desired in that person's life. There are just absolute blinders on that keep you from seeing what you decide, the choices that you make, how it's going to affect somebody else. Been there, done that, got the t-shirt, got several of them actually. In fact, we probably all do, you know,
Yeah.
to some degree. But I think something that you said, Rachel, very important is that, or the distinction, I guess, between the addiction and codependency is that codependency takes you away from, like you were mentioning, your life, you being able to maintain a job, or like you said, getting in accidents or tickets or
Mm-hmm.
things of that nature. I mean, everything just becomes like a downward spiral of
Exactly.
chaos. And I think, yeah, to me, say I have a job, I
Mm-hmm.
have a house. I don't see myself being in that category, which I'm not better than anybody. No way. Because I've been there. I used to be that person. I used to do coke, and talk about a drug addiction to cocaine. That stuff, you taste it, you smell it, you just want it. And I tell you, I lost my apartment because of it.
Mm-hmm.
That
That's exactly what I'm talking about.
and so when that right I was like 18 years old, and I am so glad that I grew out of that. I have, you know, And since then, I mean, I'm close to 50 and I've learned so many coping skills. And if that's something that I can suggest to anyone is learning coping skills to be able to manage your day-to-day life better. I've gotten, I mean, you do you, boo, right? But I've gotten tattoos to help take care of some of my issues. I've got a tattoo on my arm that I have used for social anxiety since I got it. And so, I mean, I think whatever coping skill it is, as long as it's, within reason.
Right. Yeah,
But
that's exactly it, though. That's the difference. The in reason goes out the door. So I think you.
right, for sure. Well, let me ask you just a couple more questions, maybe just one. Do you, well, let me ask you this for the future. And I know we've talked about a little bit of stuff, and I'm thinking the answer is education, but how do you see the role of marijuana in the context of drug treatment evolving in the future? Do you see the potential of it entering into a drug treatment center?
Hmm. I think the sad answer to that, I don't see it happening, and there's two reasons for that, right? I think the one reason is when you go into these facilities, right? My facility is an abstinence model, right? Like
Okay.
we're teaching abstinence, and I think that's a disconnect there, right? So like it wouldn't match, right? We can't teach abstinence and help these people get sober from all the things
Mm-hmm.
while uh, treating people with another mood altering substance, right? So I feel like that's the difficulty. I can absolutely see it, and I guess we've kind of seen it with the medical marijuana in some places, right? I can absolutely see that on like an outpatient perspective, right? It's already kind of making its way into that. But then the other piece of that is a lot of models are harm reduction, right? You're not going to find that in an inpatient facility, right? But methadone, that's a harm reduction model, right? Um, I'm taking this medication every day that is connecting to my brain so that I don't use opiates, right? So
Right.
that's a harm reduction model. So that's kind of where I see it happening for the mental health field. It's more so, well, let's use this so that you don't use that. Like I was talking about that guy earlier, the
Right.
Xanax versus the marijuana, right? Like he was so afraid to become addicted to Xanax that he went with that other option, right? He didn't go through the medical route to get it, right? But
Right.
that's kind of what he was doing. He was reducing his harm. So I think it really depends on like the model of what we're really looking at.
Right. I guess you're right. You're very right in that regard. I'd like to see more education be done on it. More public health education, like research and things of that nature, to be done. I I just bought this book. I'm not plugging it or anything like that. I'm just whatever. But I bought this book. It's called Herbally Infused and Chronically Bemused by Stoner Gump. And I forget where I was going with this.
Stoner
Education.
Shucks.
Gump.
So I guess I did just plug the book.
Education.
Dang it, but I was going somewhere with it.
Education.
Mm-hmm.
Oh yes, in this book, thank you so much, Boo Boo Cakes. In this
You're
book,
welcome.
he provides 19, let me just double check the pages. Six. Yeah, 19 pages of information about terpenes and how those terpenes are being pulled out and affect and how it can benefit someone based on this. But did you know, and I did not know this until recently, that these terpenes that are found in marijuana, you can find them in everyday things that we eat, drink, smell, things like that. I mean, you can find it in lavender, you can find it in pepper,
Hmm.
some of your spices that you use. You're going to find it. You're going to find some of these certain terpenes, because if you think about herbs, people who use herbs for healing, teas and things of that nature, they've been able to identify certain antioxidants that are in these tea bags or these tea leaves or whatever. It's the same thing with marijuana. Marijuana has leaves. I mean, it's natural. It's a seed. I mean, you cannot synthetically reproduce that seed. It's God given. But that's anyway.
Yeah, we can go on about that too.
Yeah, that is true. Well, let me ask you one last question, and this is really more a personal reflection than anything. And I'm just curious to know if you're willing to share. How has your experience with patients affected your personal view on marijuana?
That I think is the $1,000,000 question, because I I would have absolutely, I think, before this experience in my life in an inpatient treatment facility where addiction is so acute and so severe, right? And I've seen acute and severe addiction, but this is different, right? They're living there, they're away from their family. It's just different, right? I have people in my life that have been on medical marijuana. I have people in my life that use it for the exact reasons that you're talking about, right? Like I know people with explosive anger that use it to just be normal, right? And I know people, I've seen it, and I definitely have seen the benefits. But I think working with this specific population has really given me more insight into how it works in the brain, right? And how risky it can be if you struggle with other factors, you know. So I think my shift has been, oh yeah, everybody can benefit from this too. No, not everyone could benefit from this, and some people are actually more at risk.
Mm,
And just kind of not that like black and white thinking that I used to have, right? Like I used to just be like, yes, this is great. Like you're saying, it's natural. It's helpful. It's calming. It's soothing. It's appetite helping. It's chronic pain,
hmm
vomiting, nausea. You know, the list can go on and on with things that it could help.
Absolutely.
Evidence-based things that it can help, right? I think
hmm
in my research, the biggest evidence-based condition that it could help is chronic pain, right?
Yeah.
So like the evidence is there, right? I'm not saying it. The evidence is there. Do the research, right?
Right.
But
Well,
I think day to day, I'm not working with that, right? I'm working with severe addiction.
right,
So
right.
it's changed. It's changed for me in that way.
Well, I just to backpack that one and some of the things that you had said. Um, if it so Tennessee, we live right below Tennessee. They are
Mm-hmm.
currently, and this is actually going to be our next podcast after this one. Tennessee is looking to pass a House and State bill to legalize marijuana both recreationally and medically. It's been out there before, but it died. This one seems to have traction. So my question: if it becomes legal in Tennessee, well, which is extremely close to us, and let's say that the high horse is jumped on and Georgia discusses legalities of it recreationally specifically, what is your take on the future of what Georgia's population will be like if it does become legal?
I feel like ever since we talked about doing this, that has been the question on my
Mm-hmm.
mind, right? Because that happened when I lived in Maryland. I know Florida has had it on the docket for some time. It keeps getting shut down and for recreational, because I think they have the medical there as well. But
Right.
I, I can see so many different things. I can see a lot of risk, but I can also see a lot of like help. Like if I'm going back to that like harm reduction, right? Like if more people use marijuana, would less people abuse alcohol? I don't know. Right? Time would tell
Right.
that.
Yeah.
If more people use marijuana, would less people use opiates? I don't know. You know, it's hard to say. It's really hard to say, because what I've seen is that even though opiates are your problem, marijuana gets you back there because of the neural pathway in your brain. So it's just really hard for me to say. You know, I think obviously there's other implications, right? Like less legal problems due to marijuana. You know,
Right.
that kind of stuff. But if we're talking mental health, I think it would be more incorporated into treatment. I could see that, just not at the level that I think I'm working at right now.
Gotcha.
You know, I think that would become too. It wouldn't make sense. You know, it wouldn't make sense.
Makes sense. Boo Boo, were you going to say something?
No, I'm just sitting here listening because I'm just sitting here wondering, like, well, okay, what happens if Tennessee, you know, goes ahead and makes it legal? Everybody's going to scoot up the street, you know?
Yeah. Well, that's
You,
like
you know what I
the.
mean? I mean, what are they going to do? You know, I mean, it's just there's a lot of questions. And another thing to me is like, when Rachel was talking about, you know, it might be good for this person, but maybe not good for the other person, that kind of a thing. You really do, honestly, you got to kind of think about, like each person is different.
Mhm.
Like their bodies are different. How do they handle, you know, a drug being introduced into their system versus this drug or that drug? You know, it's like, for example, if you go to the doctor and, okay, for example, tramadol.
I knew
One
you were going to say that.
one person can handle it, the other person can't. They end up having allergic reactions. So it is all about what the body can handle.
Talking from experience.
Yeah,
Yeah. I'm
I had
sorry,
a
it just hit my
massive
brain.
tramadol allergic
Oh.
reaction to tramadol.
Oh yeah. But I mean, it's the same thing with marijuana. I mean,
Right.
you know, it's like it does different things to different people
Yeah,
based
you're
on their
right.
makeup.
That's
You're
very
right.
true.
You're right.
Yep.
That's very true, and that goes for anything. That goes for Zoloft, right? I have
Mm-hmm.
patients with depression who do really, really well on Zoloft, and I have
Mm-hmm.
others that no improvement. They get worse even, right? So I think you're totally right, and it's just hard to. The only way to figure that out is to do it.
Yeah,
You know,
exactly. Exactly.
that's the difficulty there.
All right.
Right. Well, well, guys, this has been one riveting discussion. I really feel like we could just keep going. It has been
Rachel, you're so
so
cool.
awesome having you, Rachel. I cannot say thank you enough for being my special guest or our special guest tonight, talking about these contraindications. I just want to say to Boo Boo Cakes as well, thank you for being part of this as well. I couldn't do it without you.
Thank you.
And Rachel, maybe one day we can have you back on and we can have a roundtable discussion with a few other people and kind of like pick each other's brains and stuff like that. I find roundtable,
That'd be
right?
awesome.
Roundtable discussions are a lot of fun. So, but I think we're gonna. So one of the things that we do at the end of our show, Rachel, you gotta start jiving because there's
Okay.
music. Yeah, just start shaking it a little bit.
Moving it around.
Yeah. We're gonna break it down. Yeah.
What?
Well, guys, I can't say thank you enough for tonight. And don't forget to tune in to the next show. It's going to be about the legalization of marijuana in the state of Tennessee. We'll be talking to a nurse and her perspective of how it could benefit or be a challenge working with patients in the state. So, guys, thanks so much. And Rachel, I look forward to seeing you soon. And you guys, y'all have a good night. Take it easy. Thank you.